Strode and welcome to Straightforward. Today I am so excited to have my personal physician, one of the most amazing, brilliant, humble doctors that I know, Dr. Jada Rhymes-Bacoat. Welcome, Dr. Jada.
Thank you. Thank you for having me.
Well, I want to tell on myself and go on and get my flunking grade. I have not followed any of your instructions. I just went through a very busy period, and it's no excuse, but unlike the children that wait till the report card comes out, I wanted to warn you before my next appointment that I failed to follow your instructions. And because you are this wonderful family physician, you want to make sure that we are healthy and living our best life.
Yes.
Okay. And so you are the founder and the owner of Whole Patient Healthcare.
Yes, ma'am.
So share with our audience a little about Whole Patient Healthcare, because you were a physician before then, a hospitalist, did a whole lot of work before you decided to establish your own.
Yes. So whole patient health care, the concept of it is comprehensive health care, taking care of the entire person, the whole person.
Okay, the whole person,
Yes.
meaning mind, body, soul, spiritual, all of that.
Correct.
Because that all works together to make sure we're healthy people.
So if you recall on the first visit, you and I spent quite a bit of time talking.
We did. Probably more than the average person, but you were very gracious. Right.
But you have to take that time to get to know the patients individually, and then that way I'm able to give you some tips on how to be healthier.
Okay, because I remember you asked me, I told you that I was a stress eater triggered by grief. And you asked me, when that happens, who is your person that you call? See, I remember that, and that's important. You said because you really have to have, that outlet or, some other place instead of just eating every bag of Lay's potato chips if they sell them in the store.
Yes.
And of course, I don't smoke cigarettes, but that's really kind of my cigarette is Lay's potato chips. But then you said, no, that's not a good thing. So who is your person?
Yes.
So that was why you were asking me all of those questions.
Correct.
Okay.
Just giving you those practical changes that you can use. And we also talked about alternatives to potato chips as well.
I don't know if that's a good thing or not. Well, it don't taste as good. But we were talking about, and you said, well, I said it's the crunch, probably. And you said, well, in place of that, maybe celery, maybe carrots, apples, and you can pre-plan it. Okay.
And let's get back to you're saying you weren't as compliant because of being busy, and so that's where your planning comes into place. Planning your prepping your meals, also prepping your snacks, making it convenient. So if you have those convenient snacks, whether it's some trail mix, a handful of nuts, some pre-cut fruits and vegetables, if you have it there, then you're not so likely to kind of get off track with those other unhealthy snacks.
Okay, the unhealthy snacks, the ones that I like. So you take care of me, and of course my husband, who always tries to get an A with you, but he's not on the principal's list this time because he didn't follow an instruction. But you take care of people from what ages?
My youngest patient is 16, my oldest patient is 100.
100, okay, and so that is how I came to be your patient. Our mutual friend, Dr. Tamori Smith, knew that you did geriatric. So that means for the old people like me, the senior citizens. So you do geriatric care.
I do.
And so that's why it's all the way to 100, and if they exceed that, then you're rolling with them to the end.
Absolutely.
All right. And so that speaks to, it's not a one size fits all. I always tell people with your care, this is just my opinion, and it might be biased, but I do have one. It is like Saks Fifth Avenue. It's not just everybody's getting the same medication, everybody gets the same amount of time with the doctor. The people that might need a little more attention get attention. If I'm just coming for my follow-up to get my prescription and for you all to weigh me, which I always know, 3 times I weigh the same thing. And you
Yes.
said you never heard of that.
I've never seen that video.
So you said I needed to move a little bit more. But I cut back.
Yes.
I did because of my husband's medical, but I still, and it was like, well, why am I doing this? I mean, I'm still at the same place. But you said just continue on that path.
Exactly. Because you have to be consistent. And so sometimes if you're not seeing your weight loss goals, or if you don't feel like you're seeing any results, what you probably need to do is examine your calories. Are you taking in some empty calories somewhere that you're not recognizing? Potato chips,
Right.
soft drinks, those things. If you can eliminate those things that aren't providing you with any real nutrients or
Coffee,
vitamins.
see, and I like the coffee international creamers. And you asked me, you said, what is it that you're doing? But I didn't think about it because I've been a coffee drinker for so long that I love the international butter pecan is my favorite, and I want 2 cups every day. And so you want me to not do that? Now, I can't say I cannot do that. So I'm gonna have to figure out somewhere else.
And that's fine. So what you have to do is you have to earn those calories. So those calories that you're taking in, you just have to make sure that those walks in the evening, you're burning off those same calories.
Okay, so you don't want me to take a leisurely walk?
No.
Because normally I am leisurely walking around around Lake Bottom, and that's where I do my prayer and my meditation. I'm not trying to sprint or sweat.
Okay.
So you're saying that I need to sprint walk and sweat a little.
It needs to be brisk, and you do need to get your heart rate up. You do need to pump your arms because you want to burn some calories.
Okay. Well, I will try and do that in the new year.
Okay.
I don't want to promise because last year, your mother and I, who worked in your office at the time, talked about how you really set me up because you gave me instructions to lose weight this time of year, going through Thanksgiving, Christmas, and the New Year. And so I knew that I was not going to be successful because I don't have that type of discipline and self-control like yourself. So that is one of my goals. I'm going to try to be more like you in the new year, but not right now. Okay. So what we're going to do now is go to our first break to our sponsors, and we'll be right back. We'll be right back after word from some of our sponsors.
Straightforward is brought to you by State Senator Ed Harbison, serving the citizens of Georgia's 15th Senatorial District and on the front lines for veterans every day. Progressive Funeral Home, family owned and operated since 1952. The George Ford legacy of high standards continues today in the compassionate and professional services provided, a touch of dignity for those who care. Progressive Funeral Home, 4235 St. Mary's Road, trusted by generations. Whole Patient Healthcare. Dr. Jada Rhymes-Bacoat is board certified in family medicine. She believes the best patient care includes practical, individualized lifestyle changes. Located at 1338 13th Avenue, Columbus, 706-641-2080, or visit wholepatienthealthcare.com.
And welcome back to Straightforward. I'm enjoying this visit with my personal physician, the amazing and beautiful, brilliant Dr. Jada Rhymes-Bacoat. Dr. Rhymes, you are just a humble vessel. Even when you chastise us, you do it very calmly. But when you leave the office, you know that you've been checked. And I like that because sometimes, regardless of our age, we need to be checked. And you want us, and I always say you have to keep me alive because, you know, I've earned the privilege of where I am in my marriage, 40-something years, and I need to be around to reap some of the benefits. But you have been very clear that I have to do my part and that we have to be our own best advocate. That's what I want you to share with our audience. You know, people come to the doctor and then they'll say, well, I take the blue pill. And you were like, People need to know what the blue pill is and why they're taking the blue pill or the green pill or the yellow pill.
Absolutely. So in my 2 years of whole patient health care, we've been seeing people who've been seeing doctors for a long time.
Right.
And we've also been seeing people who haven't seen doctors for a long time.
Really?
Because we're coming out of the pandemic.
Oh, yeah. So a lot of
yeah.
people have been since before COVID.
Exactly. And so with that being said, we are just kind of bringing people back into doing those routine screenings and just doing those routine doctor's visits. And so they'll have a bag of medicine, not knowing what each medication is,
Right.
which diagnosis it's for. And so what I would say as far as being your own best advocate, number one, know your diagnoses and know which medications you're taking for that particular diagnosis.
Okay.
The other thing is when you're going into these doctor's visits, they are checking to see how well controlled each of these diagnoses are, whether it's your diabetes, your blood pressure, or cholesterol.
Okay.
And so based on that control, then we'll do some changes in medications. Are we going to take a medication away? Are we going to increase a medication? And so anytime that there's a medication change, there needs to be good clarification. Doctor, if you are adding a new medication to me, do I still take the previous medication?
Okay, because sometimes people will take the new medicine and the old medicine, hold on to it instead of putting it aside.
Correct.
And then so we're over medicating.
Exactly. And that is a very good question for you to ask as your own advocate. You're adding this new medication because my numbers weren't where they needed to be.
Right.
But in addition to this new medication, do I continue the other medication?
Okay, now that's very important.
Yes.
It is. And then when you have, because you're the geriatric doctor also, when you have older family members, and of course my father lived to be 92, people that know us know that, but he was in his right mind, and we would go to the doctor's visits. He knew what every pill was for because that was his personality, and he wanted to know. He wanted, to be a part of his treatment plan. But for those that might not be that strong-willed, the family members need to understand what those pills are for.
Absolutely. And so I would say for a lot of people, if you know that you have a aging family member, at some point you probably need to wrap your head around getting to those appointments with that aging family member.
Yes.
Showing up to those appointments and being that person asking those questions and being that person taking those medication bottles out of the bag that they no longer need.
That's good advice. That's sage advice. And then also, this is from personal experience, as they're aging, you need to make sure they have the advance directive. And then also that if they can communicate what their desires are, all of that is so important because you might end up in an ambulance on a hospital visit and it's not time to be trying to figure that out. Then that helps to manage the family dynamics. And of course, I know that's a part of the paperwork at your office.
Yes.
They always ask that. Even at the breast care place, they ask, do you have the advance directive?
Absolutely. And it's never too early to have that conversation. And
Even young people.
Even young people. Even myself, my husband and I, we are already starting working on our wills because
Right.
you never know, anything can happen. And I want to frame it that way.
Right.
So that we can become more comfortable with having these conversations. They are not easy conversations
No.
because you really have to have a talk with your loved one about making plans for when they are no longer here.
Right.
But it is a really good conversation to have, because when they get to their last days, you're not trying to figure those things
Out. Exactly.
You can actually be there in those moments and making those memories of them.
Right. And then if there's a question about how far the care should go, what should be happening, if that has already been decided,
Exactly.
then we need to know who the main person is. It's not to be a secret. You know, and I'm sure you've seen this because you were a hospitalist and you work other places, you know, overseas, in the States, and you've seen it. That's not the time at the bedside when we're, you know, making hard decisions to have all that unresolved family dynamics.
Exactly. It gets rid of all the confusion. If you put it in black and white, mom, dad, grandmother, we know what they want. Do you want to be on a ventilator?
Right.
Would you like for us to feed you artificially with a feeding tube? Would you want those things? How much surgery do you want to have after your 80th birthday?
Oh, see, I never thought of that.
You know, those things you probably want to consider. And several of my patients, when we talk about it, they'll say, you know, Doc, I'm 85. I don't want any more surgery. And I say, make sure you let your children know this.
Right.
Because things come up as, you know, as we go along, we get x-rays. And so if there is something that is found, the children,
Right.
if they don't know, they're going to think, okay, we need to do everything possible.
Exactly, to keep them alive.
No. And so my answer to that is there are a lot of things we can do, but should we?
Okay.
And will it affect their quality?
Okay.
So just have that good conversation with them and just talk about what is the best thing for the interest of quality.
Okay. Not just existing,
No.
but quality, because you can
Quality.
exist for a year on a ventilator.
Exactly.
All right. Those are those hard conversations, but they must be had.
Yes.
Okay. So what we're going to do is go to our break to our sponsors, and we'll be right back. We'll be right back after word from some of our sponsors.
Columbus Pediatrics GA, working together to build lifelong relationships between our staff and patients by consistently providing compassion, excellence, and value with 2 locations. The Old Town office at 3580 Massey Lane, Suite F, 706-596-8667. The Midtown office, 1900 11th Avenue, Suite A, 706-323-3400. ColumbusPediatricsGA.com. Barbara's Cleaning Service, a 5-star commercial service with satisfied customers in Georgia and South Carolina, built on the principle that every detail matters. Barbara's Cleaning Service, a new season building a family legacy. The Autism Hope Center. Diane Pope has dedicated the last 3 decades ensuring that families had support and resources for their loved ones on the autism spectrum. Join the Autism Hope Center for fellowship and resources, located at 200 Hamilton Road, Suite B, or call 706-604-6333. Muskogee County Coroner Buddy Bryan. Buddy has set high standards for himself and his staff, ensuring that every citizen is treated with dignity and respect, regardless of circumstances. Buddy cares about crime prevention and is always excited to speak with students and community organizations. Reach out to Buddy at 706-653-3260.
And welcome back to Straightforward. I'm enjoying this very important visit with my personal physician, the fabulous Dr. Jada Rhymes-Bacoat. Dr. Jada, I tell you, you are the total package. Your husband is brilliant. He's amazing. He's an expert in his field. You are a great businesswoman. 2 years into whole patient health care, worked for larger organizations as a hospitalist, outside the country, inside the country, so you are well seasoned. You did a lot in rural medicine.
And I know we're here in the 2nd Congressional District, and most of our counties are rural counties. And so it takes a special kind of personality. This is just my opinion. This is different when you're in Atlanta, New York, Miami. It's a fast pace. You know, people move a little differently. But you are in tune to rural care because you actually even worked in the historic Selma, Alabama.
Yes.
Right, and you actually have staff that came all the way from there to work in your office. So, I mean, just brilliant and fully committed. So, in some of our communities, we don't have medical care in Georgia, you know that. And many of the counties in the 2nd Congressional, they really don't have rural health care. So, are you seeing people come in? Because I know you are well known now. We're doing our best to make sure that people know that you're there, where they are actually coming in, because you were saying a lot of people haven't been to the doctor since COVID. But then a lot of folks that live like Talbot County, 25 miles away, Waverly Hall, those people can come in and they can see you because you're in tune to rural.
Yes.
And the issues. The issues are different in the rural, because what? In Talbot County, it's a food desert. There is not even a grocery store. So it's important to know and to be sensitive to that, because people that only worked in the city, they might can't comprehend that.
Correct.
Right.
So working in the rural area definitely has its own challenges. Taking care of rural patients, you do have to be mindful of certain things. In particular, transportation.
Yes.
Transportation is a really big issue that a lot of my rural patients have in some of the surrounding counties. They do tend to use the different medical transportation services that are out there. And so a lot of times they may come an hour earlier.
Right, because they got to roll when the transportation is rolling through.
Exactly.
Right.
And we understand that. We accommodate for that. That, you know, we make sure that they're comfortable. And if for any reason there is a way that we can see them a little bit earlier, we definitely try to do that, because we do understand that that is a big part of it. The other thing with the transportation is, how are they getting their medication?
Exactly.
And so
it's not like us where we can say, well, call this one on the corner of that, because we got so many choices.
Exactly.
But in the rural counties, they don't have those choices.
Don't have that. You hope that there is a pharmacy that delivers to them, or mail order, but we also been having some issues with the mail getting to the patients, and the patients being able to get their prescriptions as well.
Right. So you're in tune to that. And the thing that I like about you, and I know your mother, she raised you well, is that if you can, you will see them early. And there is nothing worse for me. And you know how I am. I believe in being on time, but if we see where we can do better by people, because we know you're a doctor, but you don't know what other people might, that's important. But what they have going on is important too. And sometimes people will let you just sit, and you're like, if we can make it happen, we're gonna make it happen. Right, because you want to respect and honor what that person might have going on in their life.
And saying that to say, with rural and people coming back into medical care, we're seeing a lot of really sick people.
Yes.
They're coming through my doors extremely sick, to the point to where I'm spending a lot more time on some of these patients. And if I do get behind, I'll just go out myself and I'll tell my patients, listen, I'm running behind. If you need to reschedule, that's an option. But
see, that's because you respect people. Because see, I know your mother. She trained you right. No, really. And sometimes because you clearly communicate, people can understand that. But just to, well, it's like, oh, well. No, it can't be oh, well. Because what I might be doing is I might be coming to the doctor. But I might have some other person at home or somewhere else that need my care and attention on that end. Because even with my daddy, over the 2 years, he needed his treatment, but I still needed to stay alive so I could help see about him. Right. And so a lot of times it's just the clear communication, the compassion, and the understanding.
Yes.
And that's what I really like about you. And very approachable. And this is another thing you told me. And I want to make sure that our viewers understand this about Dr. Jada. You said when you go to a doctor, you have a right to ask them any question you want to ask them. And if they don't want to allow you to ask questions, then that's probably not the doctor for you.
Exactly.
And you carefully picked mine for my other test because you know that I was going to ask everything before I did all of these procedures that I thought I needed to be comfortable with knowing. And sometimes people just go along and they come from the visit and they don't have a clue. But I want to know. And you told me there's nothing wrong with that.
And I feel like that is the best way, so that we build that relationship, we have that mutual respect, and we're working together to make you healthier.
Exactly. So it's teamwork.
Absolutely.
It's not a dictatorship.
No.
Right. So I had some procedures, and before I wanted to be clear and what to expect and, prepare. They said, you'll be here this amount of time, bring you a snack, bring you a jacket. All of that's important. And I saw some people who showed up, they were not prepared. Because they were intimidated. They didn't want to ask the questions, but I was like, well, this is not free. I'm paying for this, so I can ask.
Yes.
Right, but I called and reported on myself, so you would know after my visit was over. So tell people where you're located and your hours and if you're receiving new patients.
Yes, so we are located on 1338 13th Avenue.
Which is right near WRBL, which is the other station.
Yes.
But I want people to know where my fabulous doctor is located. All right, right down the street from Channel 3.
Yes.
Right.
So we are there. We're open Monday through Thursday from 8 to 5, and then Fridays we're open on half days from 9 to 12.
Okay.
So you can find us on those days.
Okay, and so insurance. Do you take insurance?
Yes.
You take Medicare? Because some places don't take a lot of things.
So as you know, my passion is geriatrics. So absolutely, I take Medicare. I take all Medicare, whether it's your managed plans or the traditional red, white, and blue card. If you are an older patient, I'd love to be your doctor.
I know that, and that is why Dr. Smith sent me to you, and I think that was a blessing. Well, I want to thank you so much for all that you do. Whenever called upon, the answer is yes. You're an amazing husband. I thank you for supporting the show. Even when you were trying to work and getting your thing together, you were there supporting me and cheering me on. And we're going to do better in the new year with our health. I just need to get a pass until we get to the new year, if that's going to be okay.
Absolutely.
Okay, well, thank you so much.
You're welcome.
This has been straightforward. If you don't stand for something, you will fall for anything. Until next time, be blessed.
What up, world? What's up, Columbus? Be sure to tune in every Sunday, straightforward with Gloria Strode, right here on NBC 38.